If you are a Minnesota resident and you have a United Healthcare Medicare Advantage plan, which is also known as an AARP Medicare Advantage plan, and you use Essentia Health Services, you're going to want to watch today's video because I have some important information to share with you that you may not know about yet. So please stay tuned. My name is Jamie from meetjamie.com. I'm a licensed insurance agent based here in Minnesota, so I have my hand on the pulse of what's happening. I came across this news story, this press release, and I wanted to get it out to you guys here on my YouTube channel. Thank you so much to those who have subscribed. If you enjoy Medicare content and you haven't subscribed, please do so. If you have questions about Medicare, you can certainly leave them in the comments below. So if you are on Medicare, hopefully you know that each year your Medicare Advantage plan changes. In fact, insurance companies have to send you out each year what's called the annual notice of change about that plan. In this letter, it explains how your plan worked in this year compared to how your plan will work next year. So for this, the sake of this video, it will show you how your Medicare Advantage plan worked in 2024 and how your plan will work in 2025. And there are usually details that change about your plan that you're going to want to be aware of. Sometimes one of the changes that happens is that providers and insurance companies can't come to a contract agreement. And unfortunately, what that means is you, as the Medicare beneficiary, either have to switch to a different Medicare Advantage plan or you have to switch to a different provider. I'm talking specifically in this video if your Medicare Advantage plan will no longer be accepted at a certain provider in the coming year. This is why the Medicare open enrollment exists from October 15th through December 7th, to allow you the opportunity to review your Medicare coverage and make sure that your coverage will work for you in the coming year. So I'm going to share my screen here with you and just show you this press release that came out a couple weeks ago. It says important information for patients with United Healthcare Medicare Advantage Plan insurance. Beginning January 1 of 2025, Essentia Health will no longer serve as an in-network healthcare provider for United Healthcare's Medicare Advantage plan. This applies to care at all Essentia Health hospitals and clinics. As part of this change for patients who are covered by United Healthcare's Medicare Advantage plan, we will no longer schedule any appointments that occur after December 31st. And so there you have it right away. Big change. If you have a United Healthcare Medicare Advantage plan in Minnesota and you use Essential Health, they will not see you after December 31st. And again, I have some good news at the end of this video, so just hang tight with me as I get through this press release. It goes on to say that like other healthcare organizations, Essentia has been reevaluating Medicare Advantage plans to make sure they are administered in the best interest of our patients. In evaluating UHC's Medicare Advantage plan, again that's AARP as well, we found excessive prior authorizations and denial rates for patients who are covered by the plan. Prior authorizations are requests that healthcare providers make to insurance companies seeking approval before care can proceed. Prior authorizations check whether certain treatments, medications, or procedures are covered by the insurance plan. Excessive prior authorizations and denials can lead to delays in providing care that patients need, which can be frustrating and stressful. So again, when you are a provider, in this case like Essentia Health, you want to make sure that your patients are getting the best care that they possibly can. And so you have to ensure that by basically negotiating with these insurance companies to make sure that Medicare beneficiaries are getting the care that they deserve. And without exception, every year there are contract disputes, there are agreements that people can't come to. When I say people, I mean providers and insurance companies. And so providers stop offering certain Medicare Advantage plans. Now, this puts you as the Medicare beneficiary in a difficult spot. Again, as I mentioned earlier, because you either have to choose a new provider, in this case someone different than Essentia Health, or you have to choose a different Medicare Advantage plan. And unfortunately, this isn't done for you automatically in situations like this. The onus is on you as a Medicare beneficiary to review that annual notice of change to make sure that the coverage that you have this year will be sufficient for next year. Or I should say the coverage you have next year will be sufficient like you had this year. But you also want to make sure that your providers are in network, your prescriptions are going to be covered, and the cost is going to work for you. So I understand that most of us don't like thinking about or shopping for insurance, but it's essential that this open enrollment, especially, you take the time, if you have a Medicare Advantage plan, to review that annual notice of change. Make sure your doctors are in network for the coming year. Just a little bit more to this article. It says, we know that the relationships our patients have developed with the members of their care team are important to them. We would like to continue providing care to patients who currently have Medicare Advantage plans through United Healthcare. We hope these patients will consider switching to another Medicare plan in which Essentia Health is listed as an in-network care provider. So again, this is one of those changes, and there are many of these happening around the country for those who are on Medicare Advantage. Please do your due diligence. If you see that annual notice of change, make sure that you review it. If you're working with a trusted advisor or agent, make sure they review that with you to make sure that your plan is going to be accepted at your doctor in the coming year, and make sure that the coverage that you have for 2025 is right for you, that it suits your needs. So again, just to recap, this is something that regularly happens, something that if you're on a Medicare Advantage plan, you're going to want to be aware of, something you're going to want to pay attention to, and something that you're going to want to review again during the open enrollment. Just by way of reminder, the Medicare open enrollment runs from October 15th through December 7th. This is the best opportunity that you have to make the switch that you may need. If your coverage works for you in 2025, great. But if you need to make a change, make sure that you do it during the Medicare open enrollment. Thank you so much for watching. If you enjoy videos like this, please hit the like button, subscribe to the channel, and maybe pass it along to a friend. I appreciate you watching, and I appreciate your comments. We'll see you in the next one. Have a great day.